Welcome. Uh, this is breast cancer, and as always, I love starting with the key facts from WHO, and allow me to say they are the watchdogs. They give us the facts and what is and what isn't. So I usually rely on the information and, of course, 670,000 deaths, and this is as of 14th of August 2025. Last year, 670,000 deaths in 2022. No risk factors are there other than age and sex. Uh, it occurs in women in 157 countries out of 185 in 2022. Occurs in every country in the world. 0.5 to 1% of breast cancers occur in men. So it's a cancer that affects both men and effective interventions for early and timely diagnosis linked to comprehensive treatment, rehabilitation, palliative care essential to reduce the burden of breast cancer and to achieve and maintain optimal function and well-being, but rather an overview. It's the abnormal cells that form tumors. If unchecked, they can spread throughout the body and become fatal. So these cells began inside the ducts and with producing lobules. The insteel is not life-threatening but detected in the early stages. The nearby breast tissues invasion and it creates tumors, lumps, or thickening. Invasive cancer spread in the nearby lymph nodes and other organs metasize. Metasizing is the life-threatening and fatal. Treatment is based in-person, the type of cancer spread, combined surgery, and radiation therapy medication. So this is generally what they have. This is what WHO have, and I was able to get a hold of it. Thought maybe it would be a good idea to maybe talk about it. And as we come back here at home, it affects the women in Kenya, and it's the leading cause with 5,985 new cases, accounting for 12.5, and of course, 9.2% of deaths, leading us the cause or cause of cancer deaths in the country, and they have a high risk if they don't have a personal history of breast cancer. Clinical examinations are encouraged women of all ages. And of course, the mammogram is very important every year. So that is a diagram that I have. Not clear enough, but I'll see what we'll do in due course to get better diagrams. Maybe clear ones. I'll put it on my Instagram and Facebook, on all my other social accounts. Then there's the signs and symptoms. There's the thick and area of the skin feels different from surrounding tissue. It looks flattened or turned inward in the nipple. This is the color of the skin. The skin it changes white skin, may look pink or red, and with brown and black skin. The breast may look darker than the skin, and the chest may look and appear red or purple. Then there's the change in size and appearance of the breast, change in skin over the breast, such as skin that looks dimpled and looks orange peeling, scaling, and crusting or flaking of the skin on the breast. Of course, if you find a lump, and get to see a doctor, make an appointment. Do not wait for a mammogram. If you see a change and report any changes, if even recent mammogram show there was no breast cancer. So we love doing things in the last minute. So for me, I just wanted to know what breast cancer really is, what it entails, and I can say I've learned a lot. Uh, Thank you for being a part of it. This was breast cancer. At least I've gotten to learn. I hope you've learned and seek treatment, seek care and support from family, friends, loved ones. Cancer is not the end of life, it's the beginning. Thank you and stay tuned for more.